information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle. And we've got an interesting program today, kind of follow up on what we were talking about a few minutes ago on WMAL 105.9. We're talking about sugar. And what does that really mean? You know, over the years, we've had a program called, Sugar, Public Enemy Number One, as we said a few short minutes ago on the radio, that it's still public enemy number one, and actually in some situations is getting progressively worse, and that's what I want to follow up on. We started talking about how it affects different body systems, and we got into the effect that it has on the heart and the brain and other pathways as well. And I want to kind of continue that, but I want you to understand the something called glycation. And it's really important that you understand what takes place in the sugar process of how it damages the body. And it's not just something that says, oh, this really tastes good because there's so much sweet in it. And what you have to know, as we said earlier, that manufacturers know the addictive process of putting sugar into their substances, not just a little bit, but a whole lot. And we're talking about sodas and so forth that have anywhere up to 8-10 teaspoons of sugar per bottle, per serving. And when you know what the damage is that it causes, I would take a really good hard look and say, are you willing to set the stage for a tremendous amount of disease processes over your lifetime? I don't know about you, but I made a very significant choice years ago to say, not so much, right? I grew up in a Sicilian family that the sweet was a little bit of fig, a little bit of dates, honey, raw honey. As a matter of fact, they would go out and they would get it and they would bring it home. Rarely, when I was very young, did we have those things. As time progressed and my grandparents passed away and left this planet, then, things got a little silly and a little out of control, but I had been trained from an early age that, I wasn't in that process of craving sugars. And I want to teach you over the next few weeks how to break that sugar addiction. But that's all moving to a program that we're going to be having in-house at the Roselle Center for Healing in Fairfax, Virginia on the 21st of May. And I'm going to be doing that with none other than Dr. Scott Lamp, who was actually the initiator of the thought process, sugar, public enemy number one. So if you know Dr. Scott Lamp and you've heard him present before, he's a ton of data and information. So join us. All you have to do to register for that class is you can do it online at drtomroselle.com. You can go to rosellecare.com or give the office a call as well at 703-698-7117. But let's get into the meat of the program and kind of carry forward what we were just talking about a little while ago. Glycation is something that you really, really have to understand. We're gonna use this part of it and kind of segue it into talking a little bit more about cancer risks and the like. But glycation is a process that is believed to be involved in the complications associated with a lot of different things, not just cancer. So we're talking about diabetes, we're talking about heart diseases, we talked about a while ago, even Alzheimer's, dementia, and it begins to build up over a period of years. So if you see the symbol, if you were, or the letters AGE, and it means advanced glycation end products, it really means that what's really going on and what's the association that's involved with these disease processes. So this, we're going to kind of focus on cancer phenomena. And, it's like, okay, we have a problem here. It's very identifiable, but are you doing anything about it? And then I'm going to tell you some things that you can do to make a difference as time goes on. So just as a recap, right? So there's several studies out that found that higher intake of dietary sugars, if you will, or other substances that convert into sugar very quickly, increase the overall risk of cancer in the body. And the reason for that is that we've known for years is that cancer loves sugars. It's number one food for it, and it allows it to grow and advance through your body. Obviously, we don't want that to happen. So when you have that increased risk of cancer, in your system, and most cancer types that were studied, it seemed to be parallel across the board. It wasn't just one type over the other. It was across the board, all types of cancer. So the glycation, if you will, attaches itself to different things. Proteins are one of them. Now, when we're talking about proteins, we're talking about things that it's your protein. It's not incoming protein. And although that with cancer patients, we keep certain proteins at a lower level. Now, glycation causes an aggregation of certain phenomena within the body, and that promotes the cancer cell viability. All right. Now, remember, this is a lot of words here, but what I want you to understand is that sugar turns into glycation, and the glycation pattern then binds itself to certain proteins and things called lipids. Those are the fats that your doctor, sends you to the lab to, the cholesterols and so forth. And that goes through a chemical process that causes this glycating pattern because of the sugars. Okay. So I know that's a lot of crazy, but here's what happens. I'm going to recap what I said earlier on the radio program. If you take a saucepan and you put it on the stove and put it on very, very, very low heat, and you put a cup of sugar in it, and you just stir it and stir it and stir it. Most of you are going to tell me, yeah, what happens is caramelization. That caramelization is glycation, and it attaches itself to these protein molecules, these lipids, within your system. And guess what happens? Now you have cell destruction over a period of time. And there's a term that was used that was kind of interesting that I saw. It says glycooxidation of these different molecules and so forth. And basically what that means is that the cells are being destroyed and broken down and so forth. Now, if we're going to treat cancer, if we're going to treat any kind of neurological degenerative disease, including dementia, Alzheimer's, things that we've talked about, you have to make sure that you starve the body relative to sugars or things that convert into sugar. You got to take it away. Your body will take fat that it needs, right? Fat storage, lipids, convert them into glucose, if you will. That glucose then is what you use to fuel your body. See, when you're having too much of one thing, your body will put it into storage. That's where that excess fat comes. If you're not burning it up at a certain level, you're going to store it. There's a couple other ways of doing it. How many of you don't eat a lot, but you still got that extra poundage around your derriere or around your waistline and so forth? You've lowered your metabolism. It's dropped down. And so you have all this internal fat. And now what you have is the storage for the perpetuation of all kinds of degenerative disease. And as we look at people across the board, obviously not 100%, but we look at people that have excess weight on their body, they're the ones proportionately that end up with these neurological degenerative diseases, these cancers that show up throughout their body, diabetic patterns that are ongoing and so forth. I'm going to tell you a little bit of something about diabetes, kind of a continuation as well, in just a minute, because I want you to understand that. But let's talk about this glycating pattern that really shows up, and it's pretty ugly. So glycation, to recap, is a process that occurs when there's excess sugar in the bloodstream. Real simple, right? So when your blood sugars rise too much, then it's got to do something with it. And this sugar excess turns in this glycating pattern. I want you to remember what it looks like when you melt the sugar in a saucepan, right? It results in sugars attaching to proteins and these lipids and other things in the body, and it damages the tissue, and it contributes to excessive aging process. So those of you who are trying to stay young and look in the mirror and say, why am I getting old? Take a look at your diet. If you start seeing things that show up I'll give you an example. This is one of the things that I have in my skin, right? Now, what happened with there? Is that too much sugar? No, because my diet's not really heavy in sugar, but exposed to a lot of heat. I love to scuba dive, and I've been, virtually all over the place doing something that I love desperately. But because of the external heat, the internal heat, and then perhaps fast-acting carbohydrates, this is a glycation process. Those heavy things that you get on your body in different places. That's glycation. But the problem is that if it's on your skin, and if you reverse things, you can actually get rid of them. But what causes the glycation process? And that's the really important. Glycation is a result of a bonding of sugars, a sugar molecule, and it can be glucose, it can be fructose. And by the way, fructose is one of the worst that there is, to a protein in the body. And in a situation where it dampens the enzymatic reaction. Now, glycation can cause high sugar consumption, or can come about because of high sugar consumption. But here's the other thing that you don't know about. Glycation can come about as a result of air pollution, poor lifestyle habits, and the way that you cook things. Glycation, as I said, can affect the skin, but it can cause wrinkles and creases and things like that. Have you ever seen, an older person in their 80s and 90s, and they just, they're older, they have gray hair, and you can tell that the muscle mass isn't what it used to be, but they have this beautiful, beautiful clear skin. My grandmother was like that. And she had these beautiful eyes, but her skin was just gorgeous. It's like, did you really live, or did you just got a little older? But when you look at people's dietary patterns, there's a reason that takes place over time. And then we go through and we spend, hundreds of millions of dollars as a society, billions maybe, on trying to keep our skin clear and tight and so forth, when it comes from lifestyle and it comes from the consumption of sugar. So you have to make sure that you understand that this is one thing that you're in total control of, and it can be reversed. There's a lot of things that you can do. If you have suspicion that you're having problems with this, and all of a sudden you're seeing these little blotches show up on your skin, or you're seeing, things that, where did this come from? These little dots on your back and so forth. That's glycating patterns. There's a couple things you can do. One, cut the sugar out. I mean, drop it down, get it down, go to natural sugars, have a piece of fruit a day. Switch your diet from, the fast acting white rices and white potatoes, and do the wild rices, and do the black basmatis and so forth, things of that nature. And that's just a start. Increase your clean protein levels, increase your vegetable consumption, start getting out for walks so you burn this stuff up. Walking and exercise does something really phenomenal. It requires energy. So you're going to burn the stored sugar, and it's not going to accumulate, and you decrease your risk of causing these problems. So glycation is what we're talking about. And when you come in and join us on May 21st, that Wednesday evening at 6 p.m., we're going to get into this a little deeper. Glycation, again, what I want you to remember is a sugar that has caramelized, that attaches to proteins, your muscle mass, and other things like that. And it causes damage. It causes oxidative stress damage to your system. So if you know that, and you know that's the case, and you know that in the good old United States of America, that the problems with cancers and dementia and diabetes and degeneration of all sorts dramatically is increasing exponentially, then say shame on us if we're not willing to do something about it. But when glycation is present, meaning that we're storing these sugars and they have to be stored someplace, and we wonder why the wrinkles are there, and why we're getting older too fast. You have some people who are 50 something and they look like 80 something, and I look at them and I already know, because there's other signs and symptoms that are around their body, and I'll take a look at their arms and their hands and so forth, and see what the spots and the depositions are and so forth. When you know that's true, well, shame on you if you don't do something about it. And you say, well, I'm going to go buy all these things and spend hundreds of dollars and thousands of dollars in my lifetime and try to, reestablish normalcy when normalcy lies within you. So make sure that you understand that this is highly reversible if you take the time to reverse it. But that means understanding what it does. So glycation is, if you will, the technical chemical term is called a covalent attachment of sugar to a protein in your body. And when we talk about Alzheimer's, we're talking about these tau proteins, right? And what causes them? Where do they come from? Well, in many cases, this is what it is. It's sugars. There's a lot of other things that will stimulate it, but the sugar that you consume causes this neurological degeneration, ultimately causing you your presence, your life. So we're not going to get into it because we can get into things like Maillard reactions and so forth. But yeah, it's not for this program. That's when I run my mouth in front of doctors and so forth. But I want to get back to, the skin piece and why it causes aging, just so you can kind of tuck it away a little bit. Skin problems caused by glycation. I want you to wire that into your brain. Skin problems that are caused by glycation. So we're talking about wrinkles and creases. We're talking about spot depositions in your body. We're talking about swelling and inflammation. We're looking at things like acne. We're looking at things like eczema. We're looking at things like rosacea, all caused by, in many cases, not every case, but the greatest majority is always involved by something called glycation. So if you don't like the way your skin looks, or if you got a little bit of darkness here and it's a little thinner here and you get a little this and so forth, take a look at what the heck you're eating. And just remember, anything that converts into sugar, alcohol, right? Yeah, that's part of it as well. You're sitting there drinking tons of orange juice and eating fruit all day long, and you wonder why your skin's changing the wrong way. When you're young, anything can stand up to, any insult that you have for the most part for a short period of time. But then guess what happens? Then slowly your body can't handle it, stores all this stuff. And then you catch yourself in a piece where you're not thinking as quickly as you'd like to. You can't process, and you say, oh my God. Or you walk into the kitchen and you set your keys down on top of something, and then tomorrow morning you spend the rest of the day trying to figure out where you put them. That's called a sign that something's not right. But a compromised breakdown of your skin, we call it skin barrier, if you will, inflammation, is shown to tremendously activate inflammatory pathways everywhere in your body. So if you have any kind of injury, if you have any kind of subtle problem with your heart, with your kidneys, with your intestinal tract and so forth, and you're throwing sugars in your body, guess what's going to happen? You're activating these inflammatory reactions within your system, and you're going to see skin lesions. You're going to go to the doctor and say, oh, you have eczema. You're going to go to the doctor and say, oh, you have acne. You're going to go to the doctor and say, oh, you have rosacea, or whatever number of skin problems that you might have. Why put up with it? Why would you continue the process when it's on you? You're the one that did it. Change it. I'm not telling you to be a saint. I'm telling you that there's ways of beginning to resolve the problem. So join us on the 21st at the Roselle Center for Healing. And I promise you, you're going to see and be taught different things that you can do to save not only your mind over a period of time, to decrease the potential of cancers. And particularly in today's world, we're seeing so many different types of cancers. It's making me crazy. People are walking in and, I'm saying, this is not okay. So we sent them into our thermography unit, and Dareth Painter, who many of you know, is amazing in how she'll take it. And then she works with a group of physicians. That's all they do is read thermographics all day long. And, so we start looking at these things, and there's situations that are showing up I haven't seen in well over 4 decades that I've been in practice. So we have to do something, my friends. And this program for you on the 21st will give you tools and options and opportunities to change some of this craziness that's going on. I promise you, please be with us so we can make a difference in your life and your health. Glycation is murderous. And what you have to understand is that it's easy to understand. We don't want to understand it because we don't want to give up our sweet tooth, but it's easy to understand. So before we kind of end, I'm going to get into one other little slight piece of glycation process that makes it a little bit more understandable. Let's recap just a second. Glycation is a process in the body in which sugar molecules, it can be glucose, it can be fructose, they attach themselves to protein and fat cells, lipids, fat cells, right? The result is that you're getting this advanced degenerative change that takes place that is not necessary. It's going to cause not only the increased presence of dementia, cardiovascular disease, because your heart's going to plug up. It's going to cause diabetic patterns, but it's going to cause you to look less presentable than you should with all these things that are starting to grow on your skin, and you wonder where the heck they came from. So it can be triggered by this dietary pattern. It can be dramatically increased significantly by, you're ignoring it. So join us on the 21st at the Roselle Center for Healing. And by the way, I'm going to give you a couple of little tips right now. Besides getting rid of the sugars in your diet, what if you could take a couple products in addition to changing your dietary pattern that would exponentially clear your skin slowly over a period of time and give harmony back, where you don't have this blotchiness here, blotchiness there, and so forth? You know what? Join me on the 21st, and I'll tell you what that's all about. Anyway, thanks for joining us today. Remember, I'm here on an ongoing basis for one reason. I love you all. Have a great day. Take care. Bye.